but it is only the belief that works. ఈ టాబ్లెట్ వేసుకుంటే తగ్గిపోతుందా అంటే తగ్గిపోతుంది. తగ్గిపోతుంది అన్న ఒక వర్డ్ తోటి ఇట్ వర్క్స్ ఆన్ యువర్ ఎంటైర్ సిస్టమ్. Got it? So also it says, there is every chance that these impurities can present in food and the synthetic medicine. Synthetic medicine. Please understand the word. There is Sarvapalli Radhakrishnan, one day he just said, in his book Renaissance, he just says, what is the end of science? What is the end of science? What is the end of science? What do you say? The end of science is destruction. End of science is happiness. End of science is not no peace, but it is a belief, it is a faith. Science can be used for destruction and also for construction. Every minute you take so many medicines. Every minute. The water that you drink is not pure. The air we breathe is not pure. The dress we wear is not pure. Everything is being polluted and contaminated. In a situation like this, working on a topic like this is something wonderful and exciting. So, since the medicine used by patient, the safety of the patient is highly concerned. I also remember one aunt of mine, a cousin, she was a neighbor. Every day you take this antihistamine, Avil tablet. రోజు వేసుకున్న Avil tablet కదా అని వేసుకుంటే ఆ Avil tablet కూడా రియాక్షన్ వస్తుంది. మీరు ఎప్పుడన్నా డాక్టర్ దగ్గరికి వెళ్తే డాక్టర్ చిన్న టెస్ట్ చేస్తారు పెన్సిల్ వాటికి. రియాక్షన్ ఈజ్ సో పెయిన్ఫుల్ ఐ టెల్ యూ. సో be conscious about this. Today, the pharmaceutical world is working on the burning topic to establish controls, thereby to develop nitrosamine-free medicine, which could safeguard the patient's health. In this context, having knowledge and full level understanding of the topic is highly important to the student and also to the researcher. Medicine is the only cure for the world, technically. But there is another medicine besides this chemical medicine. That medicine is free of cost. That is happiness. That is joy. It seems the giver feels more happy than the receiver. When you are more happy, there are so many kinds of hormones that are released, and you will feel very happy. Yesterday somebody posted on a kind of flyer. He just said, "Madam, ganaka 2 minutes angry tho unte 7 hours mana hormones meeda panchestundanta. Mana system anta pollute ayipotundi. 2 seconds, 2 minutes. ఏంట్లే అనుకుంటాం. కానీ చూడండి, చిన్న కోపం ఎంత దూరం తీసుకెళ్తుంది. చిన్న కోపం సూసైడ్ చేసుకోవడానికి మనల్ని ప్రేమిస్తుంది. చిన్న కోపం అవతలని మనకు అనిపిస్తుంది, బాధగా అనిపిస్తుంది. కానీ మనం ఎమోషనల్గా బాధలే తప్ప ఫిజికల్గా ఎవరికి బాధ అవుతుంది. అది గుర్తుపెట్టాం. దెన్ most importantly, universities, academic institutions and industry should work collaboratively while investigating and identifying the root cause and finding innovative solutions to the problem. I strongly believe that this kind of events would be a stepping stone and it will create a good platform for a kind of collaborative approach. I wish all the participants to utilize this opportunity. I wish all the participants from other universities who have been invited here have a wonderful and pleasant stay at Nannaya University. And I understand that because the topic is so conducive, it's very nice, it's so lucid that people will go beyond the talk and they could understand certain things which can reframe their mindset, reframe their emotional capabilities with this wonderful opportunity that I have been given by the organizers. Thank you very much.
Thank you, madam, for your wonderful insights and blessings and your great ideas. Definitely, our students follow the same thing, and they may use this kind of opportunity for collaboration. Even our faculty members also will do the same thing for the benefit of our university. Now, it's time for honoring the dignitaries on the dais and also the person who contributed for this international seminar. Now I request our chemistry department HOD, Dr. K. Deepthi, Assistant Professor and Head Department of Chemistry, Deepthi, to initiate this felicitation program.
A warm good morning to you all, and I welcome you all to this wonderful international seminar. As a token of tradition, it is our custom to honor and felicitate the contributors and also the speakers of this program. First, I would like to invite Dr. T. Subramaniam, Managing Director, Allied Natural Oils and Fuels Private Limited, Kakinada, to accept the felicitation on behalf of Nannaya University. INTI International University. I now proceed to inviting Dr. M. Amarendra Reddy garu from NIT AP, who is also going to be delivering his speech on this occasion to accept our small felicitation. I thank all the speakers and also the chief guest of today's program for accepting the felicitation. I now request our principal, our beloved principal, who is always there in supporting in all possible ways, Dr. P. Vijayendra Madam, to accept a small felicitation. Now it is the time to honor the president of today's program and also the convener, the senior professor of Department of Chemistry, Professor B. Jagannath Reddy garu, to accept the felicitation on his dais. Once again, I convey our gratitude and heartfelt thanks to the chief guest and the chief patron of this program, Professor S. Prasanna Sri Madam, the Honorable Vice Chancellor, for supporting and being the backbone of this program. Thank you very much, Madam, for your gracious presence. We wish that your blessings may be with us in all possible ways. I request all the students to be seated. Now the most important part of this program is going to be started. That is the technical sessions. We are having eminent speakers with us today who are going to give very important insights and going to present their research work on this platform. So I wish all of you get benefited from the presentations that are going to be given by our eminent speakers. I wish all of you to participate in this program and make it a grand success. All of you please be seated. Very soon the technical sessions are going to be started. start the technical session? Placements, tell the students
A very good morning to all the students. Good morning. Thank you so much. I know many of you have traveled a long distance, starting early in the morning and then reaching here. When I came in the morning, very few are there. I was wondering how come Jagannath Reddy sir has organized a chemistry seminar in this big auditorium? That was my first doubt. But after seeing all of you, sure, this session is going to be a wonderful session because we have experts who are in this field who will be motivating you in a greater dimension. How many of you, just to have some idea, right? How many of you are in the second year of your MSc? Large. Those who are in the first years? It looks almost maybe 60-40. We have 60% of second years and 40% of first years. I know all of us have a dream. I don't know why you all have chosen chemistry when all the basic sciences are slowly coming down. You still chose to be studying chemistry. Maybe if you have a loud voice, can I hear at least one or two reasons why you have chosen chemistry? If you have a loud voice, where everybody can listen. Why you have chosen chemistry? Two options. Okay.
Opportunities.
Opportunities. Okay. Opportunities for what?
Many kinds of opportunities in chemistry.
Opportunities for what?
For jobs.
Okay, opportunities for jobs. So all other courses like economics, MBA, engineering, you mean that they don't have opportunities? Okay, that is one. Thank you for standing up and any other answers from the boys from this side? One more answer. How many of you are from organic chemistry? Great. How many of you are from analytical chemistry? Maybe 80-20. Any other branches of chemistry which you are studying? Bioinformatics, physical chemistry somewhere? Inorganic chemistry anywhere? Okay. Any other branch which I did not mention at all? Right. Many of us would like to join a job after this course. And this is I think this is the only field where it starts early in the morning in our day-to-day life and it will continue till the end of the day. That's why if anybody is downgrade chemistry, you should not feel sad. Right? From the moment when you open your eyes in the morning till you go back to bed, whatever you use, whatever you consume, whatever happens outside your body or inside your body, everything everything is chemistry. That's why this word chemistry has penetrated into dance also. They say that chemistry is working good with both the dancers on the stage, right? They say that your chemistry is good. I don't know what chemistry they see, but they say that chemistry is good with the dancers on the stage. Now we are at a stage where many people worry about impurities. Maybe if there is impurity in water, we are worried. In some areas, we will not take it into consideration. Maybe many of our foods, we don't bother much because we don't have any authority to check whether our food that we purchase outside is proper or not. We don't have any food testing agency with us. But on the other hand, when we talk about any medicine or a drug, there comes some authority who are looking into it. I know many of you would like to join pharma companies. What is the best job in pharma company? Come on. By this time you might have heard or you might have guided by somebody that if you need to get a job in pharma company, it should be so and so. What should be that? Little louder. I didn't get.
Somebody is saying R&D.
R&D. Any other? QC. Yeah. Why these two are most popular? You can go at 8 o'clock and come back at 6 o'clock. There is no C shift in R&D or QC. If you are in production side, you have 8 hour, 8 hour, 8 hour. Maybe sometimes you have C shift also. Yeah. Yes.
Hand mic.
మీరు మన ఇంటికి అతిథిగా వచ్చారు. అదే వాళ్ళకి ఇప్పుడే చెప్పి సార్ స్పాన్సర్ చేస్తే బాగుంటుంది. ఈ బాబు మనసు ఎంత మంచిదంటే ఆన్ స్పాట్ 15 లక్షలు పంపిస్తారు. ఈ 15 లక్షల్ని మనం ఎందుకు వాడతామో తెలుసు. మనకి హాస్పిటల్ లేదు. మనకి హాస్పిటల్ కొంచెం చిన్న ప్లేస్ ఉంది. ఆ హాస్పిటల్కి అటు ఇటు ఎక్స్టెన్షన్కి వీరు మనకు హెల్ప్ చేస్తారు. వీరి నాన్నగారి పేరు త్రోట హరిబాబు గారు. వారి మెమరీలో ఈ బాబు హెల్ప్ చేస్తారు. వీరు డాక్టర్ సుబ్రహ్మణ్యం గారు. ఒక్కసారి పెద్దగా ప్రజల్లో ఎట్లాంటి మనుషులు ఎట్లా అంటే నాకు ₹1,00,000 2 కోట్లు ఉన్నాయని మాట్లాడుతాను. జోబులో ₹20 ఉండదు. నిజంగానే. కానీ కొన్ని నిమిషాల విలువ ఈ బాగా నాకు తెలుసు. కొన్ని నిమిషాలు మీరు అన్నని మీ అన్నని ఎట్లా చూసుంటారు? ఇప్పుడే కదా చూసుంటారు. నేను అప్పుడే చూసాను. నన్ను సాగడానికి వారు వచ్చారు. వస్తే బాబు మీరేం చేస్తారు? ఇది జస్ట్ ఎంత మంచి మనసు, సుబ్రహ్మణ్యం గారి మీద మనకుండేది ఎప్పుడైనా సరే మనకున్న దాంట్లో ఉప్పుడు తీసి దాస్తే దేవుడు మన కొండను తీస్తారట. సో బాబు, మీ చెల్లెళ్ళు మీ తమ్ముళ్ళు హాస్పిటల్ వాళ్ళకి ఉపయోగపడాలి. ఏ విధంగా కూడా ఎంత మంచి మనసుతో సాయం చేస్తున్నాం. నా బిడ్డలైతే అది గుర్తుపెట్టుకుంటారు. అవునా కదా? సో థ్యాంక్ యూ బిడ్డ. అది చెప్పడానికనే మళ్ళీ ఎందుకు వచ్చాను. థ్యాంక్ యూ. సారీ రవి. సో రవి, యా 1 minute
చెప్పన్నా
అదే
నన్ను నెక్స్ట్ మంత్ 14, 16 ఇంకో ఏమో ఒప్పుకోలేదన్న.
We have with us Dr. V. Ravi from INT International University, Nannaya, Malaysia, who is going to give us the insights regarding his work. And at this point of time, we request him to accept the felicitation, and all the dignitaries, including our Honorable Vice Chancellor, will be going to felicitate Dr. Ravi Garu.
Thank you so much, ma'am. You came back with the good news. Shall we all give her once again a round of applause? Yeah, kindly be seated. Friends, slowly we are getting, right? Many of us want to join pharma industry either at, what are the 2 areas? QC or R&D. R&D is the most challenging. QC, maybe today's talk will help you to understand it will be further more challenging. Don't think that any of these jobs are easy jobs, because somebody's life is in your hand. When we talk about quality control, we know why we are trying to control the qualities. We have a doubt that there may be some impurity in the drug. How come these impurities may arise? What are the sources of drug impurities, and how these impurities are penetrating inside the drug? Maybe during their raw materials, or during their synthesis, or even in between. Some of them, there is nothing to worry. Some of them are so dangerous. All those dangerous to human health, and then which will be even increasing the further intensity of maybe whatsoever be the ailment or condition which the individual is undergoing. If it has another side effect, you try to control one disease, and then with the required drug, and this at the end of the process, he got another kind of disease due to this impurity that is present in the drug which you never found out. This morning we have Dr. Vishnu Marisetti with us, who came all the way from United States of America. I'm so happy to speak to him for the last couple of sessions which we tried to interact with each other, and he's now the Director for Quality Assurance. I know you all said we want to join QC. He is now the Director for Quality Assurance at Pharmaceuticals Inc. in New York, USA. He has kindly consented to travel all the way to India and to Rajamahendravaram and address all of you. Maybe this first session will surely ignite something in your mind in what way we are going, because if it is another seminar, I think everybody might have participated. The moment when you see the title of our seminar, it's all about nitrosamines in pharmaceuticals. Or I think only chemistry students only can understand the structure. Chemistry students can only write the functional groups. What is a nitroso group? What is an amino group? How come there is a nitroso amino functional group? And what are the impurities that are present in this small functional group? And how come this small moiety has such a carcinogenic effect on human life? So this first session, I now request Dr. Vishnu Marisetti to come. Okay, maybe first session, our Jagannath Reddy sir is with us, who will be dealing much with the very introduction of these nitrosamines. The moment we get into this concept, I know all of you have a book with you. Yes or no? Or did you come just for a talk or a musical program? Do you all have a book with you? Yes or no? Pen with you? You don't have? How come? Because at least we need to write few structures. We need to see them, how do they affect us. Hope if you don't have, I think you should have at least something on your mobile phone where you can chart down something as a text, so that later on after going home you can convert into a better presentation. Hope these sessions, right from session 1, 2, 3, 4, maybe we'll be here in the evening. Sure, by the time you leave from this place, you will not be the same again. You have some new inputs, some new ideas, some new things that you would like to carry on. At the same time, maybe those who are trying to build their career in this field, in this area of chemistry, maybe in a pharma company or in an R&D company or any other area. Hope this expertise, this exposure which we are going to listen today from 4, 5 different resource persons surely ignite an insight, ignite an interest in this area, and when we all go back, we will be committing ourselves that we complete our academics and then entering a field of our choice where there is tremendous opportunity for growth. So, as long as human beings are there, hope they will be using some medicines or drugs. As long as drugs or medicines are there, pharma industry will be there. As long as pharma industry is there, I think chemists will be there. Recently I met one medicine student. I said, I know you are doing medicine, it is very difficult for us to get a seat in medicine, but do you know one secret behind medicine? She said, I don't know. You do everything with a patient, but ultimately you give a medicine which is done by us chemists, that's all. Only chemists make the medicines, drugs, maybe we will make the purest form of the drug, then pharma students will help to make it into a final product, maybe in the form of a syrup or a tablet or a capsule based on it. These pharma companies give all the details. What is the effect of this drug? What are the other things that are happening with this drug? And finally, when the report goes to doctor will prescribe, and then they will be further continuing about the success of this drug. So we have a mechanism going on, but behind every successful drug, remember there is a chemist behind it. So I congratulate all of you for choosing chemistry as your career, chemistry as your future profession. Hope this session will be a great session. Now I request our the moment when Jagmohan Reddy sir is there on the stage, I could hear that vibrating environment in this auditorium. Now I request Professor B. Jagmohan Reddy sir to come out on the stage and take the first session on Introduction to Nitrosamines. Thank you. Before I request Jagmohan Reddy sir to start his session, I request Bhagyasri to give an introduction about the speaker, Professor B. Jagmohan Reddy sir. Do you know this biodata will really inspire you, okay? Whenever why we are reading biodatas? When we hear about them, you will come to know how come they have come to this stage and what are those paths which they have traveled through, so that will be a great inspiration for each one of us. Now I request Bhagyasri to come and introduce the first speaker of this technical session, Professor B. Jagmohan Reddy.
It's my great privilege to introduce Professor B. Jagmohan Reddy, an Executive Council Member and Placement Officer of Nannaya University. He has completed his MSc and done his PhD in SVU University, Tirupati, and PDF in South Korea from Pohang University of Science and Technology. Dr. Reddy has 27 years of experience in teaching and also 1 year experience in R&D, chemical development in hetero drugs, Hyderabad. He has 24 years of experience in synthetic organic chemistry. He has published 47 journals and has 483 citations. He has 6 patents on his name and he has published 5 books. Dr. Reddy was awarded as State Best Teacher in 2019, Outstanding Faculty Award from Wi-Fi International Organization in 2018, and he also awarded Young Scientist from International Union of Pure and Applied Chemistry in 2011. He has also collaborations at national level. Dr. Reddy is life member of Chemical Research Society of India and also life member of Association of Chemistry Teacher Act, Mumbai. He also of life member of IIC Agra. He also a BOS convener of PG Board of Studies, Nannaya University. Thank you for giving this wonderful opportunity. Thank you, sir.
Thank you, Bhagyasri, for your nice introduction. Thank you, sir, Professor Paul Douglas, sir, for your moderatorship.
Stage is right.
respected professor, moderator of this international seminar, Professor Paul Douglas garu. Thank you very much, sir, for your nice coordination. And all other dignitaries and my dear students. మొట్టమొదట ఈ సెమినార్ స్టార్ట్ చేసే ముందు డాక్టర్ విష్ణు గారికి అన్నట్టు చాలా ఫాస్ట్గా మళ్ళీ టైం లేదు కాబట్టి 15 minutes క్లోజ్ చేస్తాను. నెక్స్ట్ ఐ థింక్ యూఎస్ఏ యాజ్ ఎ కన్వీనర్ ఆఫ్ ద ప్రోగ్రామ్ ఐ హ్యావ్ అదర్ షెడ్యూల్ ఆల్సో, అందరిని కోఆర్డినేట్ చేసుకోవాలి. 15 minutes కంక్లూడ్ చేస్తాను. అండ్ వీ హ్యావ్ యూఎస్ఏ నుంచి ఒక టాక్ ఉంది మనకు. సో అక్కడ ఇప్పుడు దే ఆర్ ఇన్ ది నైట్ సెషన్ అనమాట. కొంచెం మనం దానికి దీనికి కోఆర్డినేషన్ చేసుకోవాలి కాబట్టి వెరీ ఫాస్ట్ ఐ విల్ మూవ్ ఇట్. సో బిఫోర్ దట్ ఐ సే దట్ అవర్ డిపార్ట్మెంట్ ఆఫ్ కెమిస్ట్రీ అంటే నేషనల్ అనుకుంటారా, international. So we proved on this day that Department of Chemistry became Adikavi Nannaya University. We are conducting with the blessing of our esteemed Vice Chancellor Madam, Professor S. Prasanasri Madam, we are conducting this international seminar. So with this opening remarks, so I am going to the just introduction, just 15 minutes lo conclude chestanu. So బ్రీఫ్గా మనం ఒక మాట అనుకుంటే, ఈ ఇంటర్నేషనల్ సెమినార్ టాపిక్ ఏం డిజైన్ చేశారంటే మా ఫ్రెండ్ డాక్టర్ విష్ణు గారు డిస్కషన్ చేసి కంట్రోల్ ఆఫ్ నైట్రోసమైన్స్ ఇన్ ఫార్మాస్యూటికల్ అండ్ అనలిటికల్ టెస్టింగ్. దిస్ ఈస్ ది టైటిల్ ఆఫ్ దిస్ ఇంటర్నేషనల్ సెమినార్. So before going into the technicality of all these technical talks by Dr. Vishnu and we have Professor Paul Douglas garu and Dr. Ravi garu and Naresh Kachari from USA. Before going to those technical talks, I may go through the very introduction about this nitrosamines, why they are having such kind of importance in pharmaceutical industry and all other things. I will go very fast. So nitrosamines, these are the molecules what we have. We can say that containing nitroso-functional group, that is NO, and they are formed by the reaction of nitrates and nitrites with the reaction of amines or amides. But especially we cannot take the amides, but amines they are taking as impurities. In examples, if you include that N-nitroso-dimethylamine and that N-nitroso-diethylamine, NDA, and tobacco, we have, if you go to the tobacco, because Rajahmundry is located where Central Tobacco Research Institute, all of you know very well, CTRI. So there what we have is the tobacco specific nitrosamines, we can call it as TAS, right? NAS. So these are the general impurities we can observe as nitrosamines. So how you can go through it? See, look at this. Nitroso means, this is the structure, the basic idea. Nitroso means O double bond N R. O double bond N R. So that's the thing we have. And what we have is, if you see, next slide, right? Can you? Then coming to the overview of this nitrosamines, overview. So overview, if you see the overview, nitrosamines are class of chemical compounds characterized by the presence of a, as I told already, NO. Okay, NO, the functional group attached to an amine. That is the basic thing you should remember. NO attached to an amine. And they are commonly formed through the reaction of secondary or tertiary amines with nitrites under acidic conditions. So this is the basic thing one should remember, that so either secondary or tertiary amines, so react with secondary amines with nitrites under acidic conditions. And other thing you remember, that chemical nature. What is the chemical nature? chemical nature, if you see, nitrosamines contains nitroso group attached to an amine, as I already told. They are typically formed through the reaction of amines with nitrates under acidic conditions and exist as, how they exist as volatile or non-volatile compounds based on molecular weight and structure. That's the thing one should have an idea. And if you see the classification, classification is also more important. Basically, so we can classify into aliphatic, aromatic and heterocyclic. So you can go for aliphatic one. So another one is aromatic one. Say, for example, you have that NDMA comes under aliphatic. And heterocyclic, they, as I told already, found in tobacco, right? Found in tobacco products, in some industrial chemicals also. So that's the thing, basic idea about a overview of nitrosamines. Go to the next slide. Not going.
I'll help.
Yeah, here I want to emphasize 2 slides with especially Ramakrishna is here from Central Tobacco Research Institute. I think Prabhakar Research Call also came, right? Both of you came. I observed. Right? How are you? So here I want to emphasize 2 slides, especially for Tobacco Institute. You know that for nationwide only we have one institute that is at Rajahmundry Central Tobacco Research Institute. They are doing on this nitrosamine. And yesterday, 2 days back, I have a discussion with Sarala Madam also. So you want to change the gene also, gene of that entire gene, because nitrosamines, these are impurities which you can observe in your tobacco products. So the thing is, here tobacco specific nitrosamines are a group of carcinogenic compounds, especially carcinogenic compounds formed during tobacco curing and fermentation, and they are present in tobacco and tobacco smoke, with NNN and NNK being particularly potent carcinogens. So that's the problem with this. So, and you can see the example is that NNK, NNN, NAB, NAT, these are the examples of this these tobacco carcinogens. Next slide. Why these DSNAs are important means, I want to tell another slide. These are considered important carcinogens in tobacco products, particularly cigarettes and smokeless tobacco, and are linked with, they are linked with cancers. What we have, that lung, even pancreas, esophagus, and oral cavity. So that's the thing, these are having importance. So that's why you should remove or you should go for reduce. That is the importance why you have to go. So these are the structures what we have, that N-nitrosodide, right? So NDMA, nitrosodimethylamine, and NPYR, NPIP. This NPIP, right? And see this, all these you can observe with NO, right? So there is a NO is there, NO, and this also NMEA and NDBA, right? NO is there. So all these are nitroso, NMOR, NDBA, all these are the, right? So what we can observe is the basic idea is this nitroso amine derivatives. So they are looking to be like this. All these are the nitroso compounds. Next. So these nitrosamine compounds are specific class of, we can say that N-nitroso compounds that contain nitroso group bonded to an amine, and some are known to be carcinogenic, and they can found in various in our products also, including food and tobacco, cosmetics, and even medications, and are formed through medications between nitrates and nitrates and amines. So these are the basic things one should remember. And it is a wide range of potential routes of formation of nitrosamines, many active pharmaceutical ingredients, APIs and impurities are themselves liable to be nitrosated either during the later stages of the synthetic process of the API. Generally, we have a synthetic drug tayar chesetappudu. So అప్పుడున్న ప్రికాషన్ తీసుకోవాలి, లేదంటే దాని తర్వాత సింథసిస్ చేసిన తర్వాత మన ఇంప్యూరిటీస్ ఐడెంటిఫై చేస్తే కనుక దెన్ హౌ టు గో ఫర్ రెడ్యూసింగ్ దోస్ కైండ్ ఆఫ్ impurities, or you have to abolish entire impurity. That's the thing one should remember. So process for the API during the drug product manufacturing or in the finishing and packaged drug product. So that is the thing, basic idea how we should go, and technicalities and everything other speakers will discuss with you. And all these are to see how this Pfizer company is right. So these drugs, this name of the drug, right? So even propranolol, this and this, we have that Pinapril by Aurobindo also, right? So all these are nothing but NSDRIS, nitrosamines, drug substance related impurities, means that drug substances containing secondary amines can react with nitrates to form that NSDRIS. Dr. Vishnu Garu will speak more on this. And if you see one drug, see, look at this. Yeah, look at this drug. అయిపోతుందా?
Basically, there is an issue in emails, so we can continue. Okay, here's the problem, you know.
Yeah, see, look at this carefully, that this drug, what we have, that bupropion, an antidepressant, has several known impurities. మనం ఏంటంటే కొన్ని డ్రగ్స్ ఇంగ్లీష్ మెడిసిన్లో ఉన్నటువంటి గొప్ప ఒకసారి క్యూర్ అవుతుంది, బట్ సైడ్ ఎఫెక్ట్స్ చాలా ఉంటాయి. సో దిస్ ఈస్ వన్ ఆఫ్ ద డ్రగ్ అండ్ సెవరల్ నోన్ ఇంప్యూరిటీస్ ఇంక్లూడింగ్ దట్ డెస్క్లోరో, రైట్, bupropion, 3-chloro-propiophenone, and various hydroxy and nitroso derivatives used in analytical method and development, what we have that quality control. So that's why one should have an idea that while you are going for this kind of impurities identifying is more important. Next slide. And this also, N-nitrosofloxacin, this is a nitrosamine drug substance related to impurity, that NDSRI, that can form during the synthesis, even storage or handling of this fluoxetine. And what is the use of this one is antidepressant medication. You can use this for antidepressant, right? So antidepressant medication, and is a concern due to the potential for carcinogenic activity. So that's the thing, this is the structure on nitroso, how you see, observe that nitroso is there. This we can write impurity as NDSRI. Next. And if you see all these importance and relevance in public health is everything. If you see the slide, so all, even liver cancer, what we have, that gastric cancer, colon cancer, all types of cancers related to this nitrosamine, what we have that that's why toxicity of nitrosamine is more. So that's why strict guidelines set by WHO and FDA and IRC to minimize it, right? So exposure of these nitrosamines, and ongoing what we have monitoring pharmaceutical and food industries, they are doing all these kind of things. Next. and sources of nitramines, industrial and environmental sources we have, and chemical manufacturing, even in rubber and pesticides and pharmaceutical contaminants and food and beverage sources, and even processed meats also, bacon and whatever you have there, smoked fish also, beer, tobacco and water contamination also presence in cured and fermented foods. In all these you can observe this nitrosamine compounds. Sources of nitrosamines. Next. And if you see the mechanism, what is the mechanism? Mechanism, see, look at this, that amine, secondary amine, right? So how you can go for react with acid, right? So how you, by the loss of minus that NO2, and finally how it's forming nitroso. This is the possible mechanism for the formation of the chemical reaction, means that we can observe that amine plus nitrate gives nitrosamine. So that nitrosamine is forming amine plus nitrite. So that's why you remember this basic idea about how nitrosamine is forming, and factors influencing this formation. There are the factors, that is pH levels, even temperature conditions, even the presence of precursor compounds. What precursors you are taking is also more important. So that is the thing. Next. And health risk for nitrosamines is, as I told already, carcinogenic effect linked to multiple cancers, as we have this related to public health, and toxicological impact also there, and liver and kidney toxicity will happen with this nitrosamines, and even DNA mutations also, DNA mutations and genetic damage and regulatory classifications, and we have that WHO and IRC FDA risk assessment is going on this health risk of nitrosamines. Next. And there are the regulatory guidelines also, regulations and guidelines, international standards, right? International standards like WHO and FDA and EMA, IRC regulations, and acceptable daily intake also limits, and even pharmaceutical and food industry compliance, and maximum allowable levels in consumables also. So there are the things. And these control of nitrosamine impurities in human drugs by Food Drug whatever administration, FDA. This FDA has issued comprehensive guidance for pharmaceutical manufacturers, and everyone should follow these FDA rules. Without these FDA rules, we cannot go for manufacturing these kind of drugs. And applicants are detection preventing unacceptable levels of nitrosamine impurities during products. So that is the problem. So unacceptable levels of nitrosamine derivative, that what we have, the nitrosamine impurities. This guidance comes in response to the unexpected discovery of these probable human carcinogens in certain medications, highlighting the critical need for a robust risk assessment strategy across the pharmaceutical industry. So you remember that there are the understanding nitrosamine impurities. We have amine precursors, nitrosating agents, reaction conditions, nitrosamine formation. These are the understanding nitrosamine impurities. Next, I'll go because I have very less time. Vishnu Gar, I will go very fast. So we have the types of nitrosamine impurities and small molecule nitrosamines, nitrosamine drug substance related impurities. Next. And even these are the root causes for contaminating formation of APIs, that is contaminated raw materials. Contaminated raw materials is one cause, and is a solvent degradation, and recovered materials also they are using, and process conditions also, how you maintain. These are the things that what we have. And in this nitrosamine formation drug products, there are the 4 steps. See that what we have, that excipient impurities, API degradation, manufacturing process, and storage and shelf life. These are the 4 stages you can observe in the nitrosamine formation in drug products. Next. And for this risk assessment, you should go for identify what we have to do. Potential sources, we have to identify potential sources and access product characteristics. And you should always access the product characteristics and analyze manufacturing conditions also. How you are manufacturing the drug is more important, right? So while you are doing laboratory lo manam oka drug synthesis chestunappudu, you should maintain ela chudali atu kada So you should go for what are the conditions you are applying. So you should analyze each and everything. What conditions you are maintaining in the laboratory. So all these things will count while you are synthesizing a compound, right? So that's the thing. Remember that identify potential sources, assess product characteristics, and analyze manufacturing conditions, and prioritize high-risk products also. You should prioritize, right? So that is which one you go for priority. That is more important. Next slide. So detection and analysis, there are analytical methods and challenges in detection, and other speaker will discuss all these things. And accept the calculations, acceptable intake limits we can see. Next. And confirmatory testing for nitrosamines is we have that what method for selection and sample preparation, data analysis and documentation. So these things you should follow very carefully. And mitigation storages for API manufacturers also is more important. Process optimization and solvent management. So optimization, suppose optimization means already one process is there, that you should go for optimizing. You should establish a procedure and management also. And control strategy for drug product manufacturers also is there, that API supplier, what we have that qualification, you should check carefully nitrosamine specifications and manufacturing controls and stability monitoring. Next. And even reformulation storage reducing NDSRIs is antioxidant addition you should do, and pH modification and concentrations. By doing all these kind of things, you may reduce the impurities. Next. And if you see the timeline for implementation for the world history is March 31st, 2021, deadline for completing risk and assessment already given, even August 1st, 2025. So recommended completion of this NDSRI that timeline to how to control this nitrosamine impurities. Next. And analytical methods also there, as I told you, have an idea that you have the chromatography technique, beautiful technique, that mass spectrometry is there, and to develop sensitive and selective detection methods for nitrosamine quantification. You can use for this nitrosamine quantification and sample preparation and data analysis. So these are the things. And other thing, as I already told, that risk identification, risk analysis, risk evaluation, risk control are good quality risk management for nitrosamine control. Next. And finally, before concluding, within 1 minute I am concluding, last 2 slides, sir. Safety considerations is more important. Safety considerations is more important because our health is more important and our safety is more important. So while N-nitroso compounds have numerous applications, even though it is crucial to handle them with utmost care due to their potential toxicity. And carcinogenic properties. That is the problem with this. And proper safety protocols you should follow, and including the use of personal protective equipment, even engineering control, and safe handling and disposal procedures must be followed when working with these compounds. That's the thing with working with nitroso compounds. And conclusion, remember that conclusion is N-nitroso compounds are a versatile class of organic compounds with diverse applications. That's why so many people are using, preparing, synthesizing in pharma industry and in the chemical and industrial sectors, because their unique properties make them valuable intermediates in drug synthesis, analytical reagents even, and building blocks for organic synthesis. However, their potential carcinogenic nature, right, necessitates careful handling and adherence of safety protocols. So you should always follow the safety protocol while you are synthesizing a drug. Even you know that retrosynthesis means breaking down of a target molecule into available starting materials. So how you make a molecule is more important. How you break a molecule is also more important. So in pharmaceutical industry, the drug synthesis is having very lot of importance because some lakhs of crores money is coming through only pharma industry. That's why you should remember safety protocol and safety engineering mechanism and everything is more important while you are doing with this nitrosamine compounds. So thank you for your kind attention with this brief my introduction about nitrosamines. I am concluding. Thank you very much, sir.
Thank you, Jagmohan Reddy sir. Shall I tell you the good news first or bad news first? What do you want? Bad news? Today we will not go home easily. Okay? I don't know. I heard that we have students from Tuni up to Eluru, right? I know it will take nearly 2 hours from here, this way or that way. So, unless you actively participate, in every session, one from this side, one from that side, so that only we can go. You want the good news also? Neither you have zeal, Josh, okay? For bad news also no Josh, good news also no Josh. No Josh at all. You are not feeling any kind of happiness or anything, as if you have come for some other kind of meeting. Okay, after seeing for one more session, then I'll tell the bad news. Okay. We have, for our second session, we have Dr. V. Ravi, all the way from Inti International University from Malaysia. Dr. Ravi has worked in the synthesis of nitrosamines. We are so happy to have Dr. Ravi sir with us this morning. And now I request to introduce Dr. Ravi sir. I request K. Pavani to come out to the stage and introduce the second speaker of the day. Okay. Anyway, because I have to tell the bad news, otherwise we will be missing second session also. There will be an examination at the end of the day. So it will be a multiple choice or written examination. Only those who pass the examination will be sent home. Otherwise, remaining all are in position only. Right? So that's why morning session itself I asked, do you have a notebook? Okay, at least few structures of MD, MA or dimethyl nitrosamine or monomethyl nitrosamine something. Okay, I don't know how many of you are at least noting down few points of how to. Jagmohan Reddy sir was mentioning about how these are synthesized, right? So keep some point of note with you so that evening it will be useful for you to go from here quickly. Sir, this is my time. I request now first Dr. Ravi sir to come onto the stage so that I request Pavani to introduce Dr. Ravi. Dr. V. Ravi, sir, welcome. Welcome to Rajmahendravaram. And now I request Pavani to introduce Dr. V. Ravi. Hope sir's presentation is ready.
Dr. V. Ravi sir pursued his PhD from Indian Institute of Chemical Technology during 2000 to 2006 and did postdoctoral research in Portugal and ICIQ, Spain during 2007 to 2009. From 2010 to till the date, he gained the vast experience in both academic and research fields. During the 2015 to 2016, he was an invited researcher visiting scientist to University of Sao Paulo, Brazil. In addition, he is having the research collaborations with King Saud University and King Khalid University. Saudi Arabia, and University of Turin, Italy. Presently, he is working as R&D senior scientist in Scripps Pharma, Hyderabad, and also elected as research fellow at INTA International University, Malaysia, and successfully generating research outputs in collaborations. He has published over 120 research articles of international and national repute, apart from 4 Indian patents. Has around 2,869 Google Scholar citations with H index of 26 and I-10 index of 60 and 2,289 Scopus indexed citations has a date to his credit. Attended or participated in more than 258 national and international conferences. Has published 3 books, 7 book chapters and 28 review articles, and participates on the date. Thanks for giving this wonderful opportunity.
Thank you, Pavani, for this wonderful introduction. Could you listen carefully from his that small biodata? After his PhD, how many countries he has visited, how many positions he has worked, various organizations, in various capacities, right, in various countries. So it's a great honor to have Dr. Ravi with us. Ravi sir, so proud of you. So I now hand over this session to you. Let's all listen from expertise of Dr. V. Ravi this afternoon.
Thank you, sir. Thank you for your kind information regarding me. So good morning, one and all. So myself finished PhD from Indian Institute of Chemical Technology, CSR. I think you are well aware of that institution from Hyderabad. Thereafter I went for postdoc and other things. Already the girl has introduced about me. Today's this specific topic, I will be grateful to Dr. Vishnu for inviting me to deliver and to share some experiences and some inputs. Basically, I think you people are from MSc Organic, na? Pharma also there? Only MSc Organic Chemistry. Analytical as well. Wonderful. Okay. So the thing is that as we will be seeing, this is my introduction. I have herbal related collaboration from INTI International University also. I keep visiting and I keep coming to India also in regular intervals. And the topic, control of nitrosamines, as Jagan has said, and what are the impurities and how it will affect the drug impurity and how it will be, how we need to mitigate. That is very, very important. And this slide I have kept because you people are supposed to learn the basics. I'm not much going into the details of very in-depth because you people should be knowing the basics of chemistry and what is happening in the world, across the world. So you can see this is Sustainable Development Goal 3. United Nations Development Program has accorded in 2015 United Nations. Out of 17 sustainable goals, this is the third one, and the topic of Dr. Vishnu, which has chosen, comes under SDG 3. SDG is Sustainable Development Goal 3. What does it say? You can see it. Ensure healthy lives and promote well-being for all at all the ages. So if you have impurities, like Professor Paul has said, what happens? It will give us side effects, and Jagan has also said. So how to mitigate the impurities and how to purify the synthesis is one step, and quality analysis is also very, very important. So this topic comes under SDG 3, and you people please keep in mind. And control strategies, the topic which Dr. Vishnu has given to me just 3 days back, and I will be generalizing and I will be going very quickly. But the basics I would like to emphasize because being an organic chemist, you should be knowing the basics. That's very important. Next only core QA or QC or whatsoever. I'm basically from R&D. That's why I'm saying. So you can see here they are carcinogens as both of them have said. And this one is very, very important. I think Dr. Vishnu and Naresh Katari will also give the same things about this. You should remember these words as Dr. Paul has said. You should be writing down or else punishment will be there. This cohort of concern, you can see this is cohort of concern. This comes under ICH M7. M7 stands for the carcinogenic, mutagenic, because it transfers the gene mutations can occur because of nitrosamines. That is the reason, and you should be remembering these things. And classification, of course, based on several things, small nitrosamines, which generally come from solvents and other things. And the complex, you can see complex nitrosamines, they come from the API products also when we synthesize the drugs. And this is very important, basics you are supposed to remember this. That is the reason I have kept this slide, because nitrosamine formation in industry, you have generally primary amine, secondary amine, tertiary, quaternary, isn't it? Because nitrogen is the fifth group and it can have valency 3 or 5. So primary amines, when they react with HNO2, nitrous acid, what happens? You know, it's a diastration occurs and you get alcohol. So if suppose, for example, you have aniline, you get a phenol. So you don't get nitrosamine. The reason I am telling you why primary amines are not vulnerable to this NDSRA, what we are talking. Secondary amines, yeah, they are very good. They quickly form the NO, and you can see here nitrogen gas relation, because nitrogen comes out, that we can indicate. And secondary amines under cold acidic conditions, insoluble ion, this is the topic of our interest in nitrosamine. And tertiary amines based on the, because you will be having the steric hindrance as well, so you can, nitrosamine formation will be relatively less compared to the secondary amine. So the order of formation of nitrosamines in API or drug molecules will be secondary, tertiary, primary, of course not. In general, I am saying. So this one you should keep in mind. And the basic mechanism you are supposed to know, and you can see here NO2 minus HNO nitrous acid, how it will look, HNO2, and this gives you dinitrogen triaxide. This is actual mechanism how it happens. So HNO2 gives dinitrogen triaxide, which in turn cleaves, and this amine when it reacts, you can see the NO bond is formed. And this is how the NNO, RNNO, nitrosamine, okay? Amine is, nitroso group is added to the amine functionality. That is the reason we call NNO group, isn't it? So, where it is present, nitrosamines, where are they present? They are present everywhere, even in air when we breathe. Because why it is present in the atmosphere? You know about acid rains, isn't it? Acid rains, everybody is well aware. You have the sulfur dioxide, nitrogen dioxide, nitrogen trioxide, N2O5, SO3, everything. So when they react with moisture, what happens? Acid rain will come. So it means NO is present in air. NO is present in air, is present in water, it's present everywhere. That is the reason I have said omnipresent. And you can see here, it's present in food, pharma, and whatnot. You can see even in beer, alcoholic beverages, rubber industry, polymer industry, it is present everywhere. So the concern, why I am saying is that it is present everywhere. During synthesis, how to purify? That is the question. Because the things next I will be talking about, it's present everywhere. And you can see here how this formation pathway, how these nitrosamines are formed. You can see here secondary, tertiary, as I said. Secondary, tertiary amines react with the nitrite under acidic conditions. Yeah, I'm talking about even in stomach also we get this, because we will be taking different stuff in which nitrites will be there, and in stomach we have the HCl, isn't it? HCl. So it again reacts with the nitrates and it forms the nitrosamines. So that gut bacteria will help it. So this is also a problem in human health, not only working in industry, outside also nitrosamine contamination I am talking about. And you can see in cured meats, sodium nitrite reacts with amines to proteins, because we eat protein, amino acids, nothing but. And it gives you this one. And nitrogen in high temperature processes. High temperature process means, what do we do? We of course, even myself also, we love to eat the grilled chicken or whatsoever. High temperature, they are getting boiled at high temperature, and we love to heat, and overheated oils also produce nitrosamines. So that's also a concern. So how we are getting, and industrial and environmental pathways, you can see it is present, as I said, and you can see here in water treatment plants, even in water treatment plants, chloramines, ozonation reactions, drinking water disinfection, NDMA, these topics I will be talking in next. As I said, N-nitrosamines can be formed endogenously in the stomach and intestines due to dietary nitrates, because whatever the fibers we eat, nitrates also go inside. So it produces nitrosamines. So in stomach also it needs to be purified. How? Next we will talk about the industry. And reducing nitrate additives in food. Generally what happens, that is the reason our elders and our doctors suggest to take antioxidants, isn't it? Antioxidants, vitamin E or tocopherol or ascorbic acid. When we have corona, we have been given the vitamin C, isn't it? Ascorbic acid. So that is why to increase our immunity. So these are very, very good, excellent for anti-nitrosamine reaction. When you have in stomach nitrosamine, just take vitamin C tablet, it will reduce it, and we will have the health benefits. And cooking methods also. Generally in Western countries, they will be having the boiling and they eat, not like too much grilling like ours. So these modifications also we need to do. Yeah. So coming to the industry as well, nitrosamine contamination an emerging threat. They are potent carcinogens, and the 2018 NDMA discovery. So NDMA discovery, it's one of the impurities in nitrosamine chemistry. This was discovered in 2018 from Chinese company. The Chinese company, like we Indians, Chinese or whatsoever, we keep preparing the molecules, API or drug molecules, and we send to US FDA. When they analyzed, they found these nitrosamines in statins. Statins are very, very important for regulating the high BP tablets, which we will be discussing. So this contamination, and you can see here raw materials, reagents, contaminated solvents. This I will briefly tell how in industry you get the nitrosamine and other things. These are the general topics: manufacturing processes, nitrosating agents. So which give the NO, HNO2, sodium nitrate, all these come under nitrosating agents. And API synthesis route, formation during chemical reactions, packaging, even in packaging also. This is very important, you should be remembering, this is very important, because only few things I would like to highlight, because being an organic chemist you should be knowing these basic things. These are the all sartans, losartan, valsartan, and all these sartans are angiotensin II receptor blockers. It means they regulate the high BP, And you can see here the beauty is You have the nitrogen, this is a tetrazole moiety. This is a tetrazole moiety. I think you have read in MSc, isn't it? Triazoles, tetrazoles. So this is a tetrazole. All in general, sartans are attached with the tetrazole. Some exceptions are there. You can see here, this is the tertiary amine, and you can see here this is tertiary, and this is and you can see how it adds on to, and you can see here this is also tetrazole, valsartan. This was recalled in 2018, and this is olmesartan, ebrosartan, and so on. And this metformin, older people will be knowing, anti-diabetic, metformin. You have the guanidine structure. All NH, secondary, tertiary amines will be there. So it is more susceptible for nitrosamine impurity. That is the reason metformin and ranitidine. Everybody is well aware. Morning, gastric problem, morning doctors give this ranitidine. So these are all recalled by US FDA. And actually I was working in glyphosate chemistry, that is a substitute for metformin, anti-diabetic in US. We are selling the glyphosate moiety because this sartans and this metformin has come out because of NDS, these impurities. The glyphosates have become very famous in the United States of America. They are suggesting, doctors also suggesting those Jardians, you call it as. And you can see here ranitidine and nijatidine. This is also for gastric things. And rifampicin, antibiotic, the structures you should be just having idea because ethambutol, for example, if you have, it is an anti-TB drug. The basic things we should be remembering during our MSc. And rifamycin, this is very famous, and this is wearing clean. For stopping smoke. It's very difficult, but for cessation. So even this also produces the nitrosamines. These are all recalled drugs from the market. The major drugs I'm talking. And the source is this one, control of nitrosamine impurities in US FDA. And this is also anxiety, duloxetine, because different moieties I wanted to tell you, anti-anxiety, gastric, diabetic, heart, whatnot. Wherever you have the secondary amine or tertiary, it is prone to nitrosamine impurities. That is the reason we should be very careful. And root causes of nitrosamine contamination. Process-related supply chain stability. These three are very important in terms of industry perspective. So, how they have come. And industry needs. You can see here urgent need for API and drug product manufacturers. Assess potential nitrosamines in any pharmaceutical product at risk for the present, develop a prevention strategy. For example, we are using in our one of the reactions, we are forced to, because we cannot avoid amines, isn't it? Amines, alcohols are the very basic things. So aldehydes, of course, carbonyl compounds. So we cannot avoid, and we are supposed to use them as a starting material to synthesize different molecules, drug products. So amines will be there, we cannot avoid them. So what should we do? Instead of amines, what other alternatives we can look for? Because these, which are recalled by US FDA, at least these molecules, scientists are trying to synthesize in alternative pathways to minimize this one. And so contaminated raw materials, this is very important. And excipients. This is the general pharma related. When you suppose if you order, because in the laboratory also you have seen Loba chemical as there, Merck or whatsoever, whichever the quality, and if you see there will be purity 99.99 or 90, 92 purity, and you can see in brackets there will be writing moisture sensitive or nitrate presence or not. So it varies. Suppose if I have an industry and if I outsource to other people, and if they don't use a good solvent to benefit their money, And what happens? The nitrosamine, like these impurities can also come. So that is why I am saying there are so many things to be discussed. Even one day will not be sufficient for finishing this one. And chlorinated solvents, these are very prone because for nitrosamine I am confining DMF and dimethyl can degrade into dimethylamine and which can turn into NDMA. What are NDMA? Any other nitrosamine impurities that I will be showing you in the next slide. So APIs. Some APIs, as I have said to you, APIs generally will contain amines. We cannot avoid amines. And how we need to manage, how we need to minimize, and impurities in reagents. Even in some reagents, we will take whatever the reagents if you remember, Grubbs catalyst or whatsoever, you might have read in PG, even palladium charcoal. So every reagent, how it is pure, we are not sure. We just perform A plus B, that gives C. And then we will just see the NMR, IR, and we will analyze the structure is there. But the other impurities which the industry wants more clarity, QA and QC should be very important. Synthesis is not only enough. So this you can see ranitidine, how it is jantac. And these are very important. Actually, use of nitrosating agents. And as Jagan has also said, pH, temperature, these two are very important for controlling the nitrosamines. I don't want to repeat the things, but in general, I will give at the end what are the things. And cross-contamination, this is very important. Shared equipment, cross-contamination also very dangerous in industry when you are working. And API manufacturing processes. And degradation pathways. I tell you, these degradation pathways during storage and packaging also. As I have said to you, in air also you have the nitric oxide. Isn't it? When you pack, when you put the ink also, it can react with the NO and it can form nitrosamine. Even at the end of after QC also finish, you can get nitrosamine also. The packaging also very important. In industry, from synthesis to final submission to the vendor, whoever the prospective buyer, that is everything matters, not only just synthesis. So all analytical division plays major role, and I advise as many girls are here, and it's very good for the girls to get into the analytical field, and we boys no issues for getting into the organic and pharma industry, but we have bright future with regard to this analytical as well as, and so you can see chlorinated water which is used in the pharmaceutical production can react with organic matter. How the nitrosating agents, different forms, how they are being formed, I am giving you the glimpses. And recycled solvents, materials and intermediates. These are very important. Actually what we do is, in our companies, when we synthesize for particular molecule, we will keep the solvent as we will put it a note. This is meant for that purpose only. Because otherwise what happens, this type of cross-contamination can happen. So particularly if you are using, you should be using the bottle with the label, proper labeling and batch number and other things. Everything will be very important. And you can see chemical reactions during drug formulation also. Drug formulation means when you add API to excipient, you need a vector, isn't it, to get into the body. You join directly, you cannot take the drug and take. So that vector also can get contaminated. It can also have nitrites. So that's an issue. So excipient also. And like this nitrate containing excipients. When we deal with sartans, metformin and other things, we will avoid the packaging things also. We will ask the vendor if it is nitrate free or not, or we need to do the LCMS and GCMS depending on the nature of the substance. And pH sensitive, as this is very important in tablet coatings and liquid formulations can promote nitrate containing excipients, some anti-alloy binders or preservatives. Recycled materials in excipient manufacturing can also introduce contaminants. And And of course, Katari will be giving more on this. So just because as a presenter, I need to show everything in a nutshell. I cannot avoid. So these two are very, very important. Please remember, because the IR doesn't give you any information, just basic information. Nitrosamines, if you want to quantify, because the actual intake, how much they are asking, the US FDA is asking. So this LCMS and GCMS are very, very important. Please do remember, only for the analysis, HPLC and other things. And the quantification, I am coming to the nitrosamine impurities. And you can see here, LCMS, as I have said to you, coupled with mass spectrometer. And these, there are several, I am just quoting 9 here, 7 simple and 2 complex, as I have said to you. And you can see here, this because of the presence of N-nitroso-dimethylamine, valsartan, ranitide, metformin were recalled from industry. Recalled from industry means, because the impurities are there and you will be having side effects, 1 in 1 lakh around. There will be a chance of getting cancer. So they were recalled. And you can see here, these are all the N-butylamine nitroso group attached to N. How they are diethyl or dibutyl, or based on that, the names have come. And analytical challenges, as I have said to you, LCMS and GCMS, this is very, very important. Low detection limits are required for, and complex matrices can interfere with analysis. Lots of papers and research can be done using this LCMS with this. And you can see regulatory guidelines for nitrosamine control. FDA, as Jagan also said, and this is very important. And we generally deal with the EMA because we supply drugs to European region. And this European Medicine Agency and WHO, CDSCO is our CDN. Just for your knowledge, I have kept the things. Acceptable intake limits. It means if it is there in the drug also, it is permissible based on the US FDA studies. And you can see here, these two are 96 nanograms per day. They are acceptable limits, NDMA and NMBA, and other are 26.5 nanograms per day. So these regular check, compliance checks and testing required in industry, and understanding nitrosamine formation, optimization step. And you can see here the contaminants, how we are, the basic thing is that nitrosating agents and amines. These two result in nitrosamine product formation. So that optimization is very, very important, process optimization. So which step? And alternative material. As I have said to you, if you have an amine which is more vulnerable to nitrosamine formation, you can take the other amine, we can get into the final product. We have to choose. That is very, very retrosynthetic strategy. That is very, very important. And in order to minimize these things, this plays vital role in industry. And purification steps, very, very important. And always remember, the concentration should be below 1 ppm. And high purity water, this is also very important. When we use in industry, if you take a deionized, distilled or potable water which we drink also, they also contain nitrites. So when you add this to the reagent or in the chemical reaction in the API, then also there is a possibility of nitrosamine formation. So everything matters, from water to whatnot. So you should be very cautious. We cannot completely avoid, but we can reach up to the standards of US FDA regulations. And ascorbic acid, I have said, even in plants also we can use as a quenching purpose. And these two are very important for nitrosamine chemists who are working. Not all the time these things work, but in general I am talking. The pH outside the optimal range for nitrization aimed for greater than 6. It means almost neutral or basic. If it is acidic, what happens? Nitrosamine formation can occur. That's the simple logic. And temperature reduction. Lower temperature obviously slow down the nitrization. So in generally nitrization reactions are done in -5-10 degrees. If you have read it, isn't it? So below some reactions depending on the steering factor and the nature of the compound, we have to increase the temperature. So at that time, the suggestions are these, because these are the mitigation strategies. Means we are reducing the impurity quantity. We are trying to. What are the, and you can see here, this is very, very important. Activated carbon absorption. This is very important. Activated carbon absorption, even in our labs also we used to do. So it can take some nitrosamine impurities. So real-time monitoring is also very important. And crystallization, of course. The beauty of crystallization is it's not that easy that crystallization can be done by anybody. I tell you, I'm sorry I'm taking your time, but when I was in ISIT, I learned a little bit, but when I went for postdoc in Europe, I learned real chemistry. So the infrastructure, how we are being given and other things, so it depends matter. The crystallization techniques I have learned when I was doing my postdoc. My professor was DHR Barton student, and it's not that easy to grow a single crystal. It's very, very difficult. And so crystallization, chromatography, these are very, very important. And these are the preventive measures. How we need to control the equipment, because nitrosamine reduction we are talking about. Even boilers, what are the plant in round bottom flask, suppose if you do in the lab scale or bench scale where we are doing, all glassware should be cleaned and should be wide. We cannot just mix all the things. Equipment cleaning plays a major role in any pharma, not only this nitrosamine. And solvent management, very, very important, because recycled solvents pose a very dangerous threat to the impurity formation. And raw material specifications also we need to write. As being a chemist, you should be starting writing. Suppose if you perform a reaction, you write it's a low bar made. It's a 95%, because next time when you repeat with the ACS grade reagent, you don't get. It may vary. Then you think that reaction, what they have performed is wrong. So, solvent and everything, because when I was in ISIT, I never used to maintain that much regard, but when I was in abroad, my professor was so stringent. Even if I go for toilet also, they used to ask, you are not there, the reaction is going on, you should inform somebody else and go. So why I am saying all these things is, how a reaction can form, the coloration, discoloration, everything. So that's what a chemist should be doing. So that's the reason I am saying. Of course, as Jagan also said, risk assessment approach. These are the potential sources of nitrosamines. Which sources will result in nitrosamine we should be identified. When we start the reaction, when we get a work order from XYZ, then we should be thinking how we can proceed. And the risk formation, implement mitigation strategies, conduct periodic testing and validation. These are the part of industry. And avoid nitrosamine agents. It's very easy to say, but it will be difficult to practice. But we can look for alternative raw materials, as said. And these are the other things, nitrosamine, how pH and storage. So these are the things, generally mitigation strategy, how to reduce the impurities. This is general protocol for anything. And you can see here risk assessment, confirmatory testing and reporting changes. And recommendations to API manufacturers. So optimized design of process in related reaction conditions, this process. And audit barrier supply chain, avoid cross-contamination, these things. And these are the general recommendations to the drug manufacturers. Nitrosamine level, if it is greater than actual intake. So this is the batches should not be released, because they will stop. They will not allow you to get into the market. And if it is less than or equal to A, then the control strategy should be followed. How we can mitigate the nitrosamine impurities. And these are the processing and the control strategies, processing and other things. And this is advanced control. Means established laboratories will be having this one. So in the PAT, you can see here, you have the sensors to detect and look for real time. and sensitive analytical methods, routine monitoring and data management. As the data management is very, very important, I will tell you in a nutshell. So this is comprehensive testing, process mapping, supply audits, stability studies, and increased, of course, future perspectives and industry compliance, how it will be. Increased regulatory scrutiny and new guidelines, absorption of advanced analytical techniques, very, very important, and focus on safer synthetic routes and alternative excipients. As I said, from crash to everything is global pharma must enhance quality QC measures, and these are the regulatory compliance and proactive risk management, robust QMS, and ensuring patient safety. Ultimately, the thing is that patient safety is important, isn't it? So, like, I'm not commenting on anything, but when we have taken COVID vaccine, isn't it? We were compelled to take, and there was left no option. So, there were so many trial and errors. And several kinds of Oxford one we have taken, or indigenous, or Covaxin we have taken, or Chinese, or whatsoever. So we may started getting side effects as well. We don't know, but at that time even they have given the malarian drug also to. So it's a trial and error. So very, very important for it's a pandemic. That's why the government has given in that way. But this is a different thing, and these are very important. And the conclusion, then I will discuss. Also, this is nitrosamine contamination in pharmaceuticals can arise from raw materials, manufacturing process, storage conditions, very, very important, water, solvents, and formulation reactions. So, addressing these risks requires strict quality control, optimized synthesis pathways, and regulatory compliance to prevent harmful exposure to these carcinogenic compounds. So, in a nutshell, I would like to tell you, from the start, when we buy the chemicals and when we take the order and when we prepare the drug, when we deliver the drug to when we outsource to the other company, for example, GVK will give to me. How I use, I don't know. They don't know. So that analytical techniques, it should be in coherence with their standards. So this outsourcing also plays. That's the reason established companies will give to the only qualified people, and that's the reason. And small, if this type of impurities are there, then they will be very stringent to give order to the even Arvindo or whatsoever also. So ultimately, please do remember. Impurities are everywhere, like in our mind. The thing is that how we can mitigate the things. That's the perspective, and it's a really wonderful topic Dr. Vishnu has taken. Really, I'm thankful to him because I also learned some things. It's a continuous learning process only. The thing is that, and I get to know some of the things, why we are synthesizing other things also I came to know from his idea. So thank you one and all, Dr. Paul. Thank you for your patience.
Any questions? Okay, thank you, Dr. Ravi sir. Really, you have covered so many aspects of almost a full picture you have given, and thank you on behalf of the organizing committee. Hey, thank you so much. Thanks. Now it's time to invite Feeling Hungry? Okay. We'll have a small session now. Actually, what they thought is after, if you have lunch now and then come for a session, either you will drowse or you feel sleepy. So they have kept something, a super session for you so that you don't feel sleepy, and they wanted to entertain you in the afternoon session. So keeping that, we'll have one more smaller session. But do you know, listening from somebody at the helm of affairs and then getting it done, and how do they do it? Okay, manufacturing a drug in India is very easy. Manufacturing a drug in US is very difficult. Because one is their cost of effectiveness. It is very costly in US. On the other hand, very, very tight regulations, very strict regulations. So we have directly from the industry from US. Now I request Dr. Vishnu sir to come over for this session. Now I request
At the student, I think. More the slides.
K. Lavanya. I request K. Lavanya to come and introduce Dr. Vishnu Marsetti. Sir, now first of all I request you to come onto the stage.
Or we'll make a student to sit over there.
I think this is working, right?
Working good.
A brief introduction about Dr. Vishnu sir and then he'll start.
It's my privilege to introduce Dr. Vishnu Marsetti. He is currently serving as the Director, Quality Assurance at Seagen Pharmaceuticals USA. He is a member of many professional bodies, including member of Royal Society of Chemistry, member of American Association of Pharmaceutical Scientists, member of the Association of Official Analytical Chemists. He done his Masters in Analytical Chemistry from Andhra University and he completed his PhD in Chemistry from Jawaharlal Nehru Technological University, Hyderabad. He acts as an editor for Journal Analytical Chemistry Letters and young editor for Journal of Pharmaceutical Analysis. To his credits, he has huge number of achievements, citing a few. He carried out about 250 analytical method developments for drug substance and drug products. He reviewed totally about more than 43 scientific research articles from a number of international journals. Dr. Vishnu Marsetti is an active reviewer for reputed international journals. Some of them are Elsevier Journal of Pharmaceutical and Biomedical Analysis, Journal of Liquid Chromatography and Related Technologies, Journal of Saudi Chemical Society Analytical Chemistry Letters. He is also designated as an external research guide in the Department of Chemistry in Githam University. He has over 23 years of rich experience in pharmaceutical, fast-paced, analytical chemistry research and development, process R&D, quality control and laboratory operations. Thanking you for giving me this opportunity.
Thank you. Thank you for this nice introduction. Can I switch off this mic or I can continue? Yeah. So students, good afternoon. So by this time you might have tried already listening to the topic of nitrosamines. But this topic is a little different than before. Of course, nice introduction was given by Dr. Jagan Mohan and Dr. Ravi. So they gave some insights how the nitrosamine will be forming and the consequences of the nitrosamine will be causing a cancer, which we don't want. You're all going to be future scientists, right? So first of all, I would like to thank all the students who have participated in the poster presentation. You did really a good job. Clap for yourself. So with that preparation of poster itself, you got a lot of information on it. So what is the nitrosamine? How it is forming? What are all the chemical structures? A lot of information you already got it. And with this very good introductory sessions, you already know about the nitrosamine. So now I am going to present an important topic for you as well. Why? Because industry already aware of this topic since 2018, but we didn't reach to the student level, right? So if it reaches to the student level, you are going to be very familiar with the topic when you go for an interview to an industry. So if you talk about this topic, the industry people will be very much satisfied. That means it is helping to your career. And on the other hand, there is a lot of research opportunities here. You can take up the topics and work on in laboratories. You can sometimes we may be providing very good solutions than industry professionals. So only thing you need to start your engine of brain, right? So start thinking on it. So today I have chosen a topic called CPCA approach. CPCA means carcinogenic potency calculation approach. So as of now, we know that there is an impurity possible from the process based on our process knowledge and experience. So once we know that, so how to calculate that limit? So how will we going to calculate a limit for impurity? We should have toxicological data for that any chemical. So then only we will be knowing that limit. But from the processes, these are all new impurities. To have toxicological data, a lot of time is required. So, time is required, animal studies should be done. From that, outcomes should be done. All the results should be compiled. Then we should arrive at a safe limit. For that process, it takes several years. So, at the time of struggling with this issue, industry, FDA, Europe, and other health regulators came up with a proposal and proposed this CPCA approach. So before we go to that CPCA approach, I would like to start with some questions. What are all those questions? So what is the difference between NSA and NDSRI? NSA means nitrosamine, NDSRI means nitro drug substance related. So understand the basic difference. These are all small molecules. These may be bigger molecules because drug chemical structure is a little bigger. And another question, when a new nitrosamine NDSRI is identified in pharmaceutical, so what is our next action? What we have to do? What is the specification? What is the acceptable specification? Means what is the limit that we need to allow? How to establish an acceptance intake value? What is the acceptance intake value? We may not control to 0 level, but not to get that cancer, maybe certain limit, 100 ppm is our example I'm saying. So below that, if it is present also, it is not going to impact that. So, but how to arrive, how to calculate that value? That is the first question all the scientists were facing before. So limit calculation formula says, to calculate that limit, first of all we need maximum daily doses of the product. Maximum daily dose, we already will be knowing from the product information leaflet. So whenever you got prescribed from a doctor, you can get a pill, from that you will be getting maximum daily dose. So then we know what is the maximum daily dose. So the formula for calculating limit in ppm is acceptance intake divided by maximum daily doses. But acceptance intake value should be in nanograms and the maximum daily dose should be in milligrams. So the result would be in part per million. Okay. The AA limit is based on toxicological assessment originally, but as I mentioned, toxicology may not be always possible. So that is why this CPCA approach will be useful. So all the organic chemistry students here should learn this. It's not that tough, but you should learn this. You can do some research on new molecules and you can really publish beautiful papers with the help of research scholars. So try to understand this important topic. Definitely it will be useful for you. So ICH M7. What is ICH? International Conference on Harmonization. M7 guidance talks about genotoxicity. So genotoxic impurities, how the limit can be established, what are all the limits it will be mentioned in the ICH guidance. That guidance, international means it is applicable to entire world. So that says 1.5 microgram per day is allowed. That is the safest limit. So that means 1500 nanogram per day. So if at all genotoxic impurity is present. But these impurities, nitrosamine impurities, are cohort of concern. Means it is definitely going to change, react with our DNA. So even the limit should be too low than 1500 nanogram. That is the first slide I would like to mention. As I mentioned, that CPCA approach provides guidance to calculate acceptance intake value. So the CPCA approach for NDSRI workflow shows like this. So we need to know the chemical structure of the nitrosamine, NDSRI, and we need to know structural features. Say for example, there is a nitrosamine chemical structure is there. You need to understand what next to the nitrosol group. What is next to the nitrosol group? So there is an alpha carbons, first carbon next to the nitrogen, and there are beta carbons. So just remember this. Our topic is always related to this. So you need to calculate first alpha hydrogen score. So there is a nitrosol group and it is in the mid-sitting middle. If something right, there is a carbon, how many hydrogens present on alpha carbon, and similarly next step. And you need to calculate deactivating feature and activating feature. So these three calculations, if you do, will be establishing an acceptance intake. So this is the workflow. I couldn't completely show here, I think it is blurry here, but I can read. So the first workflow talks about, does the NDSRI have hydrogens on alpha carbons? So if there are no alpha hydrogens present, definitely that A limit directly goes to 1500 nanogram, because here they divided into 5 categories. Class 5, Category 5, Category 4, Category 3, Category 2, Category 1. So Category 3, 4, 5 are comparatively less toxic impurities, whereas Category 1, 2 are highly toxic. So how it is classified? Based on these principles. So if there are no alpha hydrogens present on both sides, definitely it is going to be directly 1500 nanogram limit. So which is a little relaxed compared to the other categories. And if the NDSRI is having one or more hydrogen on the nitrogen group, still that is also going to give 1500 nanogram. And if the NDSRI compound is having tertiary carbon, you know the tertiary carbon, all 4 are already substituted on the carbon. So if that kind of group is present on alpha, that is also coming to 1500 nanogram. So similarly, when it goes down, the potency score, when you calculate the deactivating feature and activating feature, so if the limit is, the score is shows a value, then it is going to, the score if it is greater than 4, it's going to again 1500 nanograms. Means all the first 4 boxes is going to 1500 nanograms. If the calculate potency score is 3, then the limit is 400 nanograms. Here I couldn't show, but I could memorize that. And if the another value is for category 2, it is 100 nanograms. And when it goes to category 1, which is highly toxic, the limit is 26.5 nanogram. You can see more details here. First now, how to calculate an alpha hydrogen score. So here, I have an example, but here I couldn't see clearly, but there is 0 carbons on the left hand side. On the right hand side, only 2 one carbon with 2 hydrogens. Then the value, we need to take alpha hydrogen score as 3. And the second case, 0, 3, means on the right side of the carbon there are 3 hydrogens. And the next case, 1, 2, 1, 3, 2, 2, 2, 3. So in these scenarios, you will be getting alpha hydrogen score 3 in the first case, alpha hydrogen score 2, alpha hydrogen score 3, like that. Based on the combination of alpha hydrogens on the both sides will be giving a value like that. So we need to see the chemical environment and find out the value. So that score you need to note it down. So here is an example of different molecules. So here I have shown all classes of top classes, class 4, 5 and 4, 5 here I mentioned. So in this case, if you see nitrosodiclophenac, here there are no alpha hydrogens there. All the 4 bonds already attached, so there are no alpha hydrogens. Directly it belongs to category 5, 1500 nanogram. So similarly other molecules if you see, nitrosobupropion, nitrosamine have more than 1 alpha hydrogen or 1 or both sets of the nitroso group. In the second case, only 1 alpha hydrogen is there. So in that case also, limit goes to 1500 nanogram. Similar example shows the values are directly equal to 1500 nanogram. In the third case, nitrosamine have tertiary alpha carbon, means see in the case of nitrosobutamol, in the case there is a tertiary carbon next to the nitrogen. So that is why directly that limit also goes to 1500 nanogram. So with the determination of structure itself, we can calculate what is the limit of that particular nitrosamine. This is lisinopril and this is nitrosobupropion, belongs to the category. And now we know how to calculate alpha hydrogen score with the different combinations. And after that, now we need to see the deactivating features. So here there are different compounds mentioned. So deactivating feature means the value we are adding. So that is why all the right side table shows +3, +3, +2, +1, +1. If these groups are present in the chemical structure, you can add up that value, that number score will be higher, so the toxicity is going to be lower. So in this case, in a chemical structure of NDSRI, if you have any carboxylic acid functional group in its chemical structure, you can give a +3 score for it. So secondly, if the nitroso group in a pyrrolidine ring, you see in the second case, that 1 nitrogen is in 5-member ring. So in that case also we can give a score of +3. So in the third case, nitroso group in a 6-member ring containing at least 1 sulfur atom. If that is a scenario, we can take +3 value. So nitroso group in a 5 or 6-member ring, so then +2 value is coming. So nitroso group in a morpholine ring means there is a 6-member ring with oxygen in it. So then it is giving only +1. So like that you need to see in your nitrosamine if is there any similar kind of chemical structure is there in it. Then you can add that values to the total score. I repeat, to get that acceptance intake value, we need to calculate alpha hydrogen scores and deactivating features. So you need to follow this table, that's it's very easy. And the fifth case, if any nitroso group present in 7-member ring, that is showing +1. If any, in the next case, chains of 5 consecutive non-hydrogen atoms, cyclic or acyclic, both sides of acyclic nitroso group. Not more than 4 atoms in each chain may be in the same ring. So that means there is a nitroso group. Next to that, consecutive 5 carbons on the left side, consecutive 5 carbons on the right side. Means non-hydrogen atoms. And that also at least 4 carbons only should be in the ring. Remaining should be in aliphatic group. In that case, you can add +1 score. So definitely don't be confused of all these structures. If you go through, definitely you will get it. So other deactivating features, if you calculate, if there is an electron withdrawing groups present on, say for example, electron withdrawing groups bonded to alpha carbon on only one side of nitroso group. Say for example, there is a nitroso group in 5-member ring on that alpha carbon. So there is a ester group present. In that case also +1 you can add. And electron withdrawing groups bonded to alpha carbons, both sides of nitroso groups. See, one side, one electron withdrawing group, directly +1 value. If both sides present, +2. Hydroxyl group bonded on beta carbon means there is a nitroso compound. There on the OH group present on beta carbon. So then +1 value will be there. Hydroxyl group bonded to beta carbons on both sides of nitroso group. So see in the case both sides present, +2 value. So like this we need to see that reference and calculate the score. These are the examples for calculating different compounds, the acceptance intake value for the other category. So since the chemical structures are not clear here, so I will be giving you the document, you can go through that. So the main point that we need to take here is some compounds with nitroso ciprofloxacin. See that in the nitroso ciprofloxacin, nitroso group is on the piperidine ring, pipergene ring. So that means there are 2 alpha hydrogens on both sides next to the nitroso group. So we need to see the combination of 2 to what is the score. And then there is 1 carboxylic acid already present. So then we can calculate that value is giving category 4, which is 1500 nanogram. Here another case. Proteapine. In the proteapine chemical structure also, the values are nitrosomerabiglone and nitrosoprimidexol. All these values So it's going to category 3. Category means, as I mentioned, it's a 400 nanogram. So based on structural features, we can calculate the potency score and we can categorize which category it belongs to. So earlier we calculated alpha hydrogen scores and then followed by deactivating feature and now activating feature. In the activating feature, there are minimal calculations. Aryl group bonded to alpha carbon. So then you are getting a minus value, -1. Methyl group bonded to beta carbon, again -1. See the chemical structure here. If there is a nitroso group, then there is a big aryl group connected to alpha carbon. Then the score would be -1. And in the second case, methyl group bonded to beta carbon. In the ring, the next to the beta carbon, there is a methyl group present. So in that case, -1. So what we need to understand, in the case of activating feature means it is enhancing the toxicity. That is why the score is coming down. So that means it is coming on lower category nitrosamine. few examples here I mentioned. So nitrosocetrylene, so the limit for nitrosocetrylene is coming under category 2. So the limit for category 2 is 100 nanogram. So the limit is reducing, right? See, in category 5 and 4, it is 1500 nanogram, whereas in category 2, it is 4, category 3, it is 400 nanogram, it is when it goes to category 2, it is 100 nanogram. So the limit is reducing, means the toxicity is increasing. So that means higher the score means higher the acceptance intake value. These are all some nitrosamine limits which already previously people discussed. So, but the category 1 means highly toxic, that is like 26.5 nanogram for US FDA, whereas for Europe market it is 18 nanogram only, which means even lower. And if it is a category 2, 100 nanograms. You can take this table for reference, one as a keynote. So if it is a category 3, 400 nanogram, we are comfortable with category 4 and 5, 1500 nanogram. So at least take that message of this categorization. So overall now in this discussion, we have came to know that the carcinogenic potency calculation gives us an acceptance intake value calculation through calculating 3 important features. One is alpha hydrogen score, and second one is deactivating feature, and the next one is activating feature. So summing up all the scores, whatever the number comes, that is giving an acceptance intake. So based on the category, the total number will come in a category number, so you need to then map to the acceptance intake value. So if any new nitrosamine, if I give any chemical structure to you people, you should be able to calculate. I request Jagan Mohan Reddy and chemistry department to take up that and to give some structures and calculate carcinogenic potency. Here there is a big research opportunity for you, because with the available artificial intelligence or computer technologies, you can utilize the chemical structures and you can develop programs, because these are all simple mathematical calculations. If at all such group present, what is the category and what is the nano? So if you develop a program like that, so entire university will get a good name for that kind of. Why I am saying, though it is a very graduate level chemistry students, but the thought is important for research. If you come up with a new brilliant idea, which you can map this kind of mathematical calculations from chemistry, from computers background, if you match that, sometimes you can create, exceptional things. So that's it. In fact, that will be useful for this kind of situations as well. So what I would like to emphasize here, there is a research opportunity here. So you can do this with just calculations, right? With the chemical structures as well. And there is another concept called total limit for total nitrosamine impurities. The challenge is now, if only one impurity present, how to calculate. If more than one nitrosamine present, the simple way is, standard approach is, if there are 2 impurities, say for example, limit for NDEA is 26.5 nanogram, whereas limit for NDMA is 96 nanogram. So what could be the total limit? Total limit could be the most potent nitrosamine limit, whatever it is, that limit is only applicable. So that means 26.5 nanogram is only applicable for total nitrosamines. So that is one concern. So it's very hard to reach that specification or to get a product with that kind of stringent controls. So that is why later US FDA published a flexible approach as well. So this flexible approach helps in getting at least reasonable limits for total nitrosamines. This table presents here, if there are multiple nitrosamine presents, the total we need to consider specification. But in the 3 months data, if you see, the limit value is crossing 100%, which is failing. So that is why a flexible approach is better for calculating total nitrosamines. This also you can understand, this is also related to mathematical calculations. Even after the seminar or the discussion, if you have any questions, some interested organic chemistry or analytical chemistry students have any doubts in calculating this kind of thing, you can approach me. I will try to help you clear that doubts. So there are example molecules which previously they have presented. So in that, diltiazem is one drug which is related to heart complaint, and fluoxetine, sertraline is related to antidepressant molecules, and sitagliptin is an antidiabetic. Mirabegron is overactive bladder, pramipexole, podiamine. There are several molecules under category 3. Category 4, 5, you see, as I mentioned, Dr. Jagannath mentioned bupropion, it comes under category 4 and 5, means the limit is 1500 nanogram. For ciprofloxacin, 1500 nanogram per day, lisinopril, amlodipine, if anything is there, 1500 nanogram. So first of all, as a researcher, you need to know some molecules, what are the limits for that kind of molecules, which category it is coming. You can take literature search is also part of research. So take some molecules, calculate CPCA and categorize which category it is going. If you develop a database and publish, that is also useful for the researchers, future researchers. And these are all big class of molecules, you can refer it later. This is just a timeline chart, as I mentioned, just go through it. So when the first time nitrosamine guideline published in 4th August 2023, later industry has to do certain risk assessments and analytical method development and reformulation as well. And finally, August 2025, right, is coming, right? So all the products in the US market should meet to the requirements. Whatever the limits that we discussed, all the drug products in the market should meet to the limits. Otherwise, it's going to be recall. So that means all the products will be getting banned. So which is a huge loss to the manufacturing companies, right? So this is also timeline. I will quickly go through that. This is a nitrosamine risk assessment timeline chart. Confirmatory testing October 2023 already passed. NDSRA risk assessment reports confirmation testing. As I mentioned, confirmatory testing should be done. The product should comply before 1st August 2025. All the companies are working on it. Here, the second topic, quickly I will go through. First topic we covered of calculation of acceptance intake values through CPCA approach and some of the example molecules with different categorizations we have seen, and you can really work on it. And the risk mitigation strategies. As the previous speakers mentioned about the risks, right? So what are all the risks they have and how to mitigate it. So for that matter, I have developed a tool. A tool means a checklist and a scoring checklist. So whether the product, if you see, is there any high risk, medium risk or low risk. So risk assessment is always important while assessing this kind of nitrosamines. So here, what are all the sources? As I mentioned, drug substance could cause, and the equipment and process that we use could cause, and solvents and water could cause, excipients may cause, packaging and storage may also cause, NSRI. So this chart is called Ishikawa diagram. I think it's not clearly displayed here. So all the probable causes are those. So drug substance means, as you mentioned, raw material, solvents, reagent, catalysts. any degradants and manufacturing process. Manufacturing equipment and drug product manufacturing process also. In the say, for example, in formulation processes, fluid bed dryer will be used. In that, if you use elevated temperatures, as you mentioned, elevated temperatures is also a root cause for it. So we need to consider that one also. Solvents and water also may contain nitrates, so which may be one of the precursors for nitrosamine impurity formation. And excipients, packaging, why I am mentioning nitrocellulose will be sometimes used in the packing materials. That nitro group will will be in contact with our medicines. Then the reactions could be positive. And during storage also the impurities may be increasing. So here I developed a tool. All 6 categories I have developed 20 different questions. This is a tool even industry researchers can also use this tool by answering that question. You are getting a value that is your own understanding. You can give a rating on 1 to 10 and write a number there. So if it is high risk, 7.5 and above. It is an average risk, 5 and above. If it is low risk, below 5. Like that, for each point you can categorize, and then finally you are going to arrive what is the overall risk of that, the nitrosamine impurity formation. So first question here it shows drug substance is having any secondary meaning. Yes or no? If it is yes, risk is high. No, risk is low. So similarly, drug substance is having any tertiary amines chemical structure. So as I mentioned, primary amines won't react, only secondary amines. But why tertiary amines and quaternary amines we are also assessing the risk? Because those compounds may degrade through dealkylation processes and may form again secondary amines. That secondary amines will be again reacting with the nitrates to form a kind of nitrosamines. That is why that assessment also we are doing. Question answer yes means risk, you can put it high. No means low. Degradation impurities having any secondary, suppose not only drug, in the drug, if there is an impurity, if that impurity is having again secondary amine structure, that also you need to consider. But in that of secondary kind of situations, you can consider risk as medium, not as high, because it is not a real drug substance, it is an impurity in the drug substance. So again, that impurity reaction will be little less compared to the drug. That is why the risk you can consider medium and a score of 5 you can give. And does the degradation is having any tertiary amine in its chemical structure, which we already discussed. And the next category, whether sodium nitrate on all the synthesis, sodium nitrate or nitrate usually used in the quenching process, like it's shown before in all the sartans families like irbesartan, olmesartan, valsartan, there is a azotization process will be there. In the azotization processes, they use potassium nitrate, sodium nitrates or those. So if directly we are using a process, salts like that, potassium nitrate or sodium nitrates, there is a rich source of nitrates there, right? So we need to avoid that kind of processes, we need to look for alternative processes. So that also will minimize, nitrate sources. The additional questions, so we are all discussing about the reaction favorable conditions are acidic conditions, right? So in the process, if you are using any HCl, so directly you can give a score high, because HCl we are directly using, which is acidic. So then, if you are not using any HCl, then you can give the score 1. If you know the particular material solution pH, if it is acidic, you can give score high. If it is higher side, above 7, then you can low risk, means you can give a risk score of less than 5. Whether usage of sodium nitrate or other nitrates in the manufacturing process, which we already discussed. Overall drug product formulation pH, as I mentioned, you can prepare 10%, you can take the tablets and crush it and prepare an aqueous solution and check the pH. If the pH is low, you need to conserve, otherwise low risk. And does manufacturing process involve fluid bed drying? As I mentioned, elevated temperatures may be there. So if that kind of elevated temperatures are used in the process, you can consider that risk high. And is there any theoretical water or the water hues present in the compounds? If the water present means that also is a favorable condition. So you can consider that a moderate risk. And the place, organic solvents contain nitrates, again risk high. Say for example, nitroglycerin. So any kind of nitro compounds we should avoid or minimize. And if water is used in the granulating liquid in the processes, that also we need to consider moderate risk. Any of the excipients used in the formulation has potential chances of having nitrates and nitrates. That's what some of the students presented. Excipients, how much nitrates or nitrates present? That poster is already there. So, if in that case also nitrates present means you need to give high risk. Any excipient used in the formulation using any kind of nitration in its process also you need to consider that risk. So like this 20 different questions are there. So we are almost at the 18th question. Does the drug product packing materials in bottles or caps? So nitrocellulose, if it is there, you need to consider, otherwise the risk is low. So does the leading foil is free of nitrosating agents? That is one question. Leading foil, sometimes in the bottle there is a foil, right, silver foil. Sometimes in that also nitrates will be there. You need to consider that risk also. Does the storage conditions is indicative of increasing water content in it. So that also moderate risk. So with that overall formulation, you need to compile this to finalize that. So in that any secondary amines, tertiary amines, nitrate are present in any kind of formulation components, or you can tabulate it and compile, check yes, and acidic condition yes. If all the conditions are say coming as yes means secondary amine yes, and acidic condition yes, temperature high means definitely there is a formation of nitrosamine. So then the risk is high. So you need to list down all the nitrosamine NDSR impurities from the above risk assessment and draw the chemical structures. And once you know the chemical structure, you can calculate the acceptance intake value through CTCA approach. So first you need to assess the risk and identify the structure and then calculate CTCA through different approaches. If the risk of a product based on the assessment, initial and stability means if the risk is high, if overall if you calculate average score is coming 7 and above for all the factors, then what is going to be the result? The risk is overall high. You need to have some measures. Confirmatory testing is required. If the risk is low, no confirmation testing is required. The analytical methods that you use to test those nitrosamines should be fully validated. So that nitrosamine's analytical talk is there. I'll be checking your patience. So let's see, he's waiting from US. So let me complete quickly. So in that for any analytical method, all analytical chemistry people, what is important? Selectivity, sensitivity, accuracy, precision, linearity, ruggedness, robustness, all these are important, right? So then only analytical method can be validated, then only we can use that analytical method for testing. So here the main challenge is sensitivity. So we don't use a less sensitive method for quant. If your method sensitivity is 10 ppm, that means your method only can detect 10 ppm level impurities If the impurity limit is 0.5 ppm, what is the point of using that method? It's no way useful. So that is why the method sensitivity is important. If the batch analysis result shows less than 30% of the limit, so then continuous testing is not required. Only one-time confirmatory testing is enough to justify, no additional testing required. If the batch analysis result showing results trending beyond the specification, so then that means if the results already high means you need to modify the formulation and control the nitrosamine impurity limit with the specification. In case of post-marketed products, already marketed, it's in the market. Firm should work with FDA to establish interim limits during the CPCA implementation period. That is going to complete before August 2020. So I'll quickly go avoid or minimize using of secondary amine. As he mentioned, it is very tough to choose out the secondary amine molecules, but wherever possible, try doing that. Test and control the levels of nitrates and nitrates in excipients and water. Adjust the pH towards basic side and use nitrates-free excipients. Nowadays, since this issue came, all the excipient manufacturers are developing excipients with nitrate-free. So, if you store that compound properly, the nitrates will not be there. So, if you use that kind of excipients for formulation, you will be getting nitrosamine-free medicine. Do not exceed the process temperatures and humidity. As I mentioned, these are all temperatures and humidity are causing. Do not go over temperature processes. Develop a suitable analytical methods which is really required. Yep. So since the time is very less, I am quickly winding up. Set stage-wise limits and achieve overall control. So it's almost done. So overall with this session, so what we calculated, so CPCA approach for calculating acceptance intake value. So with the different categorizations and the formulas we have seen, and after that risk assessment we have seen, and risk mitigation strategies also. In summary, we have seen within the less time. So definitely, I recommend all the students to go over the reference materials and calculate the acceptance intake values. Without doing any experiment, you can utilize this one, right? So thank you all for your patience because it's a lunch time, I know, but you're all patiently listening. Thank you. I wish you all the best.
Thank you, Vishnu sir, for elaborate, almost all highly technical session on how to calculate, how to mitigate, how to assess, right from theoretical background to practical component. We are so thankful for bringing the latest updates in the field of nitrosamine assessment there. Now, we'll be going for a lunch break. I request Professor Jagannath Reddy sir to give the final announcements regarding the lunch break. Thank you.
We'll come back again after lunch by 2:30. Naresh Kathari from USA and other speaker we have. And poster presentations also we have. And after that we have cultural programs also. So all students are requested to go for lunch. Those who came from outside, please go to our university canteen and you take your lunch and come back to here by 2:30. Then we will start the session by exactly by 2:30. Thank you. And certificates will be distributed after the last technical session with the administration, right? Thank you.
సార్ అయిపోయింది సార్ ఎగ్జిట్ కొట్టమంటారు సార్ ఇది అయిపోయిందండి స్టాప్ స్ట్రీమింగ్ చేయమంటారా ఎగ్జిట్ కొట్టమంటారా స్టాప్ స్ట్రీమింగ్ కదండి స్టాప్ స్ట్రీమింగ్ కొట్టండి